The committee will come to order. The Oversight Committee exists to secure two fundamental principles. First, Americans have a right to know that the money Washington takes from them is well spent. And second, Americans deserve an efficient, effective government that works for them. Our duty on the Oversight and Government Reform Committee is to protect these rights. Our solemn responsibility is to hold government accountable to taxpayers, because taxpayers have a right to know what they get from their government. It's our job to work tirelessly in partnership with citizen watchdogs to deliver the facts to the American people and bring genuine reform to the federal bureaucracy. Today, as we view a continued rollout of the Affordable Care Act, we deal with the administration's selling technique. The administration sold the health law to the American people with a simple, clear promise. If you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor. After millions of Americans received notices that their plans were being canceled, the President was forced to acknowledge just how misleading he had been. The President apologized for his the President apologized for people who were misled by his claim and found themselves in difficult circumstances. And the quote is, "I am sorry that they are finding themselves in this situation based on assurances they got from me." We've got to work hard to make sure that they know we hear them, and we are going to do everything we can to deal with folks who find themselves in tough positions as a consequence of this. End quote. Now there's mounting evidence that the President's second promise is also untrue. Americans cannot keep the plan they like, they cannot keep the doctor they like, and it's increasingly clear that more needs to be done to keep the President's assurance that we will do for folks everything we can. Americans deserve to hear the truth. The administration has been stringing them along with promises that every day are being broken. Many of these promises were predictable. Many of these occurrences cannot be reversed. But to the extent that we can bring the American people the truth of what's happening and reverse, in any case we can, the lowering of access to care, we must do it. Initially, in Minnesota, for example, the Mayo Clinic was only going to be open to people virtually within walking distance. Now it is open, because of the backlash, to at least people in Minnesota. But as a Californian, the ability to get reimbursed if I'm the California Exchange for the Mayo Clinic does not exist. And this is true throughout the country. Just last month, thousands of doctors were terminated from Medicare Advantage plan networks, including in 2,250 in Connecticut alone. Thousands of seniors are facing the loss of physicians they relied and trust on. In Florida, there are areas of southwest Florida in which no oncologist exists for patients who currently have life-threatening cancer. Many Americans who are shopping for plans on the Obamacare or Affordable Care exchanges have found that they offer extremely limited provider networks that exclude their preferred physicians who they have built relationships with. Many parents are finding out that their child's pediatrician is no longer covered by their insurance plan. We now know that exchange plans exclude our nation's best hospitals like Seattle's Children and Sloan Kettering, the MD, Anderson Cancer Center, and the like. Unfortunately, millions of Americans are likely to find out early next year that their new health insurance plan doesn't cover the doctors who they most value and trust. Such limited plans demand that we ask the question, what quality of care will Obamacare actually provide? The access shock has prompted many Americans to ask, didn't the President promise me that I could keep my doctor, period? On November 19th, the White House press secretary explained that the President meant by that you can keep your doctor was that if you want coverage from your doctor, you can look and see if they're on your plan if there's a plan in which your doctor participates. Clearly, in the case of federal and state exchanges, it is unlikely that the best and perhaps most expensive physicians will ever be available. Just this past Sunday, a key architect of the law explained, if you like your doctor, you can pay more for that doctor. Before the Affordable Care Act was passed, you had that right, and you had the right to pick a plan that suited you and paid for that doctor. In essence, the public is now being told if you like your doctor, then you can try to find a plan that carries them, and then you can pay more for that plan. But you're already paying more for plans that include items you don't want, items you didn't need and likely will not need. This is so unacceptable to the American people that there is no question, both through public polls and, if you will, even my Democrats no longer touting the main benefit of the Affordable Care Act being the improvement of affordability of health care, there's no doubt at all that if you could pass this bill again, you couldn't pass it in this Congress. Even if you had not read it and you knew what was going to happen, you would not vote for it. When our government, including the Congress, passed this law, we have a solemn duty to honestly inform the American people of what is going to happen. In this case, clearly the American people were misled. This duty is no more solemn when it affects the Americans' relationship with their physicians. That is a sacred trust. It is the most important thing in a life or death situation to many Americans, and it is a trust that has been broken. Today we will hear testimony from experts at think tanks and institutions. They will be on our second panel. We have concluded that the first panel should include 3 doctors who have actual life experience practicing with patients and realizing what can or cannot be done, what should or should not be done, and direct experience of what is happening under the Affordable Care Act, not just to their practices, which are businesses, but to their patients, who are human beings in need of their care. Today, the testimony from these physicians will describe in the most candid and personal terms exactly how the Affordable Care Act, or Obamacare, has affected these patients in their practices. I'm sure these doctors will agree that there were problems in the healthcare system that needed to be reformed. The fact is, America had an imperfect system developed with a number of public and private forms of money, tremendous federal taxes, insurance companies that were often difficult to work with, and the like. But a broken system that is repaired by crashing it in a wall is not, in fact, a fixed system. And with that, I would recognize the gentleman from Maryland for his opening statement.